Hello, this is Kim Jong-il. Today, we are going to discuss the cases of reproximation. This is a 40-year-old female patient with chief complaint of lip protrusion. A slight lip canting and lip protrusion are observed. In panoramic X-ray, missing third molars and periodontal problems are observed. The upper incisors are built up with composite resin, presumably in order to close diastema. Ramus height is shorter on the left side, but the canine and molar keys are class 1. In PA X-ray, lip and occlusal canting with higher left side are observed. In addition, due to higher antagonal notch on the left, the lower midline is shifted to the left. In intraoral photos, class 1 canine and molar keys, generalized black triangles, and composite resin restoration on the upper central incisors are observed. Let's take a look at this patient's ODI, APDI, and CF. ODI is the sum of AB to mandibular plane angle and palatal plane angle. Since the ANS is positioned inferiorly, a positive sign is applied to palatal plane angle, so ODI is 70.5. A negative sign is given to AB plane because A point is anterior positioned, so APDI is 80. Combination factor is 150.5. These measurements indicate class 1 skeletal pattern, and the lips are protruded with regard to the E-line. FMA is 34, U1 to lip line is 4 mm, and UOP and POP are steep. The upper incisors are slightly lingually inclined 108, and the lower incisors are labially inclined 97. Interincisal angle of 120 indicates slight lip protrusion. Here is the patient's practical problem list. 1. Protrusive lip is resolved by extraction treatment. 2. Lip canting should be noticed to the patient that it can be fixed by surgery. 3. Due to periodontal problem, non-extraction treatment should be carried out if possible. 4. Black triangles can be removed by reproximation. 5. The mesially angulated lower molars need to be uprighted, so is it better to extract or not? 1. The problems with non-extraction treatment are protrusive lips and labioversion of the lower incisors. 2. The problem with premolar extraction treatment is deterioration of periodontal problems and black triangle. Which treatment option has more problems? There are more problems with premolar extraction treatment. During diagnosis, explain to the patient about facial asymmetry lip canting, and periodontal treatment should be proceeded. Discuss with the patient about possible treatment plan, but reproximation would be the better option. The amount of stripping and retraction of the anterior teeth are almost equal. Each interproximal contact in the anterior teeth can be reduced by 0.5 mm, so a total of 2.5 mm of space can be gained. However, due to a slight crowding, the amount of retraction would be about 1.5 to 2 mm. When is it better to start reproximation, before or after alignment? In this case, it is better after alignment to some degree. Periodontal disease was treated before orthodontic treatment, and then the appliances were strategically attached. After alignment with 0.16 SS wire, initial reproximation was performed. By using energy chain between the first molars, the anterior teeth can be retracted slightly. When energy chain is used, rather than between the second molars, It can be used between the first molars or the second premolars, depending on the area of reproximation. After the spaces were closed, reproximation was performed once again. It should be checked that the teeth are free of hypersensitivity during reproximation. Any teeth that cause discomfort should be left out. On 0016 SS wire, energy chain is used again between the first molars. In order to upright the mesially angulated lower molars, Mio arch wire were used in the upper and lower arches, and short class 2 elastics were used. Appliances were debonded after midlines were matched and proper occlusion was established. Canine and molar keys were already class 1 before the treatment. While maintaining this occlusal relationship, the anterior teeth were aligned, the lips were slightly retruded, and smile became more natural. Because the patient was treated with non-extraction approach, the amount of uprighting was not significant. In the pre-treatment frontal photo, lip canting and shoulder height difference are observed. However, after orthodontic treatment, lip canting is improved as the higher left side of the lips is somewhat leveled with the right side. The treatment took 11 months in total. In reproximation cases, there are not much changes in cephalometric measurements because the teeth do not move radically. In the superimposition of the pre- and post-treatment X-rays, 1.5 to 2 millimeters of retraction of the upper incisors can be observed. In post-retention photos after 44 months, the occlusion is stable and periodontal health is maintained. These are profile and occlusal views of the pre- and post-treatment and post-retention photos. Of course, the premolar extraction would have retruded the lips by a lot. However, in case of black triangle, the extraction of premolars can deteriorate black triangles, and periodontal health is likely to be compromised with age. To sum up, in adult patients with triangular crown shape and lip protrusion or crowding, reproximation should be considered as the primary treatment option. If the patient wants more retraction of the lips, the premolars have to be extracted. So it must be discussed with the patient prior to orthodontic treatment. Thank you for watching.